Hey, just want to say, hey, welcome. Thank you for tuning in to another Freedom Friday. My name is Denise Solomon. I am a therapist here at Grow, Empower, Transform Therapy. We offer in person sessions as well as virtual sessions in the state of Florida. So if you need a therapist, let us know. Our phone number here is 813-563-8227. Our website is www.gettherapy.org. That's www.gettherapy.org. And today I want to come to you and speak with you about trauma and trauma response. So I just want to define trauma. Trauma is a deeply distressing or disturbing experience. Now, just because I have trauma from one experience and you experience the exact same thing does not mean we will have the same trauma response. An example I can use is a car accident. I was in a car accident back in 2017. I do not remember what happened, so I'm able to get in the car again and drive. I was in a previous car accident back in 1995. Woke up, I was surrounded by pine trees. So anytime I smell the scent of pine, my trauma response is back surrounding those pine trees. And to this day, I don't like the smell of pine. I do not want to be around a real Christmas tree. I'm good. I'm okay because that takes me back. So that's a response to the trauma that I experienced from that first car accident. Second car accident, I do not remember it at all. The guy ran a red light. That's it. By the grace of God, I am alive. They had to tear the door off. The fire trucks, they had to take the door off to get me out. Unconscious. I don't remember anything. However, after that, when the green when the light went from red to green for me, I just made sure everybody stopped. That was it. And then I proceeded to go. So much better, than that now. Still trying to make sure everybody stopped because, sometimes people don't. And that's what happened. So after that car accident, I was able to get back into a car and drive. I don't have a response to that traumatic experience. So the response come because we're so overwhelmed and we're not able to cope with that situation. So when we respond to something, it is our reaction. When something happens to us, we react in a certain way. I may react differently to the death of a loved one than you may react. My healing may look different from yours. So I cannot say that it's healthy to compare your healing to a healing that someone else in your family may do. We cannot say, hey, this thing happened back in 1995. Denise, get over it. It's just a smell of pine. We don't heal the same way, and we don't have the same trauma response to it. I hear so many times people will say, you know, the event happened years ago, or I thought you really didn't like that person, or it was okay that the breakup happened, or I mean, it's just a house that you lost, or you just lost a job, or any type of traumatic experience to you to get over it. It's not fair to expect someone to get over something that they are just now experiencing because we have no idea how it makes that person feel. The response that many individuals can have anxiety. We know what that can look like. That can look like panic attacks. That can look like anxiety attacks where your chest is tightening, where it's hard to breathe. Your heart is beating very, very rapidly, and you're sweating. You're clenching your fists. You're clenching your teeth. You're just tightening your whole body because your mind is in that fight or flight mode. It's in that freeze, like something's happening to us. We're responding to something. Many times, the individuals that is having that, they cannot control it. So um, anxiety and panic is one response that individuals have. Also, fear. Depression may come into play. Any a traumatic event happen, it may leave that person depressed. For example, we talked about the anxiety and panic attack. Many individuals that suffer from that also suffer from depression. Their body has a reaction. They have to wait until that moment passes, however long it takes. This individual will become depressed because what they were supposed to do, which is be productive, They were no longer able to do that. Now they have to take the time out and they're so down. Why does this keep happening? And it makes them sad. Another one is flashbacks. Many times when we think of PTSD, post traumatic stress disorder, many individuals will have flashbacks of the trauma that happened. Not only will they have flashbacks, they'll have those intrusive thoughts that just come, which causes them to think about that trauma. The person will also have nightmares. So if you're dealing with any of those, it is best to seek help, for that. And if you're supporting someone with that, it's best to encourage them to seek help and to help them look at their safety plan. Hopefully they do have a safety plan in place for when these responses do happen. They know what to do. They'll have these healthy coping skills that they can use to work themselves out of having that response. Something else that happens, these people or the individual may feel helpless because they're having these responses to their body. It's something that they cannot control. The thoughts is something that they cannot control at the moment. It just comes. It just floods your mind. Also, they don't really have a sense of self. It gets diminished. They don't know who they are. They feel like they're losing their identity. And for a lot of individuals, having this mental health issue really puts them in a low place because they believe they should be strong enough to get out of it. Some individuals feel angry. They'll feel grief and loss because of the incident that happened. It may have taken away their freedom. It may have taken away time, something precious, someone special from them. They want to just go back to being normal. Some individuals turn to alcohol and drugs just to numb themselves so they don't have to feel. But when that high comes down, you still have to feel and you still have to deal with that. And there's help out there. Therapy, of course, I'm a therapist, so I'm going to say to seek a therapist's help if you are dealing with this. If you know someone that's dealing with this, encourage them to seek some help. If you're looking for a therapist, there's many individuals I can recommend for you to see. There's therapy for trauma. There's therapy to help with the behaviors. There's different coping skills that you can learn. We're here to help. A lot of times, many individuals will depend on their friends or they'll depend on their family to be their therapist. That individual does not have the capacity to help you if they have not been trained to be a therapist. That's unfair. So I just want you to know that having a trauma response does not mean it's the end of the world or it's the end of your life. You can get help. The help is out there for you to seek. We're here to help. We're here to listen, and we're here to help you through the issue that you're currently having. So just trauma response. The next video, I will talk about the different types of trauma because there are different types of trauma. And again, you may experience the same trauma that I experienced and we'll have different reactions from it. Totally normal. It's okay. I want you to be kind to yourself, give yourself grace, forgive yourself, love yourself, and be proud of yourself. This is something that you're experiencing for the first time, something that you're going through, and you're just not working through it. Give yourself time and patience to work through it. It's not always quick like popcorn, like the microwave, but really give yourself time to work on it and to work through it. So again, my name is Denise Solomon. I'm a therapist here with Grow, Empower, Transform Therapy. If you're looking for a therapist, contact us. Our phone number here is 813-563-8227. We can refer you to some therapists, friends and family. I'll refer you out. Anyone else, you need to see a therapist, we're here. We're here to help you. And this is what we do, and we love what we do. And one thing I forgot to say is that, yes, children can feel trauma and they have trauma responses as well. So really, really pay attention to your children. Anxiety can look like post-traumatic stress disorder. That can also look like ADHD. That can also look like depression. Like, so many things can overlap. So when you are noticing things with your child, please get your child checked out by their doctor. The doctor may recommend that your child see a psychiatrist. That's fine. Be honest when you go in. Be really, really honest. If you're not sure if a good psychiatrist, again, call me, let me know. I'll look in the community. I have friends that are case managers, people that, they're in that field, so I can recommend some people for you. I just want you to know that the help is there. It's out there. We're looking to help, and it is okay to ask for help. So thank you for tuning in to Freedom Friday. I will be live on Instagram on Sunday talking about forgiveness. So if you're able to tune in, go ahead and tune in. You may have seen a flyer. I'll post a flyer again. Be great to have you tune in. I believe it's at 5 p.m. I'll double check the time, Eastern time. And again, love yourself, forgive yourself, be proud of yourself. Don't be too hard on yourself. Okay? We're all working through this life together. We're all working through 2020 together. 2020 is not over yet. So we have no idea what else is going to happen. So give yourself some grace and some patience while we continue to finish out the rest of this year. Thank you again for tuning in to Freedom Friday. And remember, www.gettherapy.org. Forgive yourself, love yourself, and be proud of yourself. Thank you.